Well, on our show today, we have a new guest, although she is with some folks that we hear about all the time, Breastlink. We have Dr. Nimi Kapoor, and you are a breast and thyroid surgical oncologist. Welcome.
That's right, thank you.
Nice to have you on our show.
Great to be here.
The first thing I want to know is a little bit about your background and how long have you been practicing?
So I've been with Breastlink for the past 2 years.
Okay.
I started at the mothership in Orange.
Oh, really? Okay.
And recently we opened the Laguna Hills site to kind of help accommodate South County. There's just too many people coming all the way from San Clemente and south,
Right.
all the way up to Orange.
Okay. How did you get to be an oncologist? What made you choose that as your specialty?
So oncology is the study of cancer. And as a surgical oncologist, my focus is on surgery for cancer. And I've focused on breast and thyroid cancers as my specialty.
Okay, and explain the connection between the two, because quite often you do hear that if someone has breast cancer, that they often look at the thyroid and other parts as well, but how are they connected?
There is a rare genetic link between breast and thyroid cancers, but I think for me and my training and background, more interestingly, the two are both endocrine organs. So they're both responsive to hormonal stimulation, and all of my research and background has been on endocrine systems, starting all the way back to college. So I've always been drawn towards the endocrine system, and both really are interrelated in that form. For breast cancer, there's a lot of genetic research that's been, predates even med school for me, and genetic differentiation of different breast cancers. And actually, it turns out in thyroid cancer, there's the same kind of modeling. And in my research for thyroid cancer, we use the breast model for the thyroid cancers, and we found the same kind of thing.
Interesting.
So.
Are you finding with all the research that you have read and that you probably have been a part of in some ways, just from what you do, that are you seeing that in cancers in general, that there may be a genetic link that we are possibly certain people more predisposition to get cancer rather than others? You may have the exact same environmental situations growing up, but are you seeing that?
Yeah, certainly. There's definitely certain populations, especially younger people who develop cancers early on, especially multiple different types of cancers. There's definitely genetic link.
Okay. Have they found any of the actual genes that are there yet?
Yes, absolutely.
Okay.
And so some of the panel testings include things like P10 for Cowden syndrome, which is a correlation between breast and thyroid cancers. So there's a lot more research and interest in this area.
So maybe one day we'll get to that point where there could be some sort of a vaccine or something that
Vaccines are very much on the rise, and I think it's definitely a big part of research in both, and definitely in breast cancer, as well as other kinds of cancers like melanoma.
Yeah, that's great. Good news. Breastlink, you've been with them a couple years, I should say.
Yeah.
Tell us a little bit about why you came to Breastlink a couple years ago.
So Breastlink is really different. I've trained at wonderful academic places like Cornell and Sloan Kettering. I came over back to the West Coast where I grew up, John Wayne Cancer Center and Cedars-Sinai. All of them are these amazing academic centers with multidisciplinary work, meaning when you're treating a cancer patient, you have surgery, radiology, medical oncology, radiation oncology, and plastics all required for the treatment and care of a cancer patient. At Breastlink, what is very, very special about it is all of these come not just under one roof, but even in the same exam room. So one of my cancer patients comes in and sees me at the same visit in the same room at the same appointment time. They can also see a medical oncologist and sometimes also their plastic surgeon. It's very special. I think it's a very unique thing, and it's great for patient care.
What is I'm going to try and pronounce this here, oncoplastic reconstruction?
So this is, it's a secret because a lot of community surgeons don't talk about it.
Okay.
It's where we treat a patient for cancer. Often we do what's called a lumpectomy.
Right.
We don't take off the whole breast. We save most of the breast and just remove the cancer. When that happens in some patients, that causes a misshape. an asymmetry between the two breasts. One breast may become smaller. And to help with that, we actually offer oncoplastic reconstruction, meaning we have a plastic surgeon help us provide symmetry at the same time at the same surgery. So that's great for cosmetic outcomes, but there's a lot of older patients say, well, I don't care how I look so much, just get rid of the cancer and move on. The real secret is that if we can take out enough tissue around the cancer, we can actually avoid radiation, especially in patients 65 and over. So this is one of the best ways of achieving that and actually sparing people from extra treatment.
Okay, so that you can, at the time...
That we can do at the same time.
Yeah.
And a lot of places can't do that because it really requires coordination and patience with scheduling appointments with a plastic surgeon, scheduling surgery with a plastic surgeon, and that takes time. And in the community and other places, it requires a lot of delay. And patients don't like waiting. And the benefit with Breastlink is we can do that at the same time.
Very good. New surgical techniques are always coming out.
Absolutely.
What has been some of the advances that you've seen over the past couple of years?
I guess 5 years ago, nipple-sparing mastectomy was one of the biggest advances we had in our specialty. Definitely a more challenging technical operation that requires a lot of extra training and time to understand how to actually save the nipple, the areola, and all of the skin around the breast while removing all the breast tissue from below.
Right.
So that offers sometimes for the right patient the best cosmetic outcome. That's definitely big and on the rise, and we're doing this routinely. One other very unique thing we do is something called intraoperative radiation. So normally when patients have a small breast cancer and have a lumpectomy, they need 6 weeks up to 7 weeks of radiation. That's radiation every day, 5 days a week for 6 or 7 weeks. It's quite cumbersome and onerous on a patient. Intraoperative radiation is targeted radiation just to the cancer. So at the same time of surgery. So it's one treatment for their surgery and the radiation all done in one time. And we offer that. It's quite a complex thing to have such a big team effort. And it's great that we can have this.
Yeah, it really is. And the fact that they have such a great team over there and work together for the best outcome. And that's really what it's all about.
Absolutely. I mean, coordination of this care requires a monstrous world, an effort to do.
Yeah, it does. And the tagline that Breastlink has often talked about, and it's in their ad, is one center, one focus, one team. And I think the one focus part is probably the most important.
Yeah, and actually, women go to these, women's imaging centers, breast centers, that they appear to be dedicated to only breast imaging. At Breastlink, we're not just appearing like breast-focused people, but we're actually all specialized. So our radiologists have all had extra training and have focused their whole careers on breast imaging only. Our surgeons have all had extra training and have only focused their whole careers on the treatment of breast diseases.
Yeah.
Same with our medical oncologists. They're not treating every kind of cancer head to toe. They're up to date with all the latest research. They know what's the best avenues of treatment and the most latest treatments. And really to do that for breast cancer really requires complete dedication.
All right, very good. And it's great to have you on.
Thank you, you too.
I find it really interesting about the genetic part of it, and that maybe someday we can get to that point where there's that vaccines can be taken as we do with other things. When someone is just a young child, if they see that this is part of their genetic background.
Yeah,
great.
There's definitely interest in prevention. That's definitely where we need to go with research. We've figured out some of the most sophisticated cures and surgical techniques. Obviously, the next step is finding that way of prevention. There's some simple things that can be done. It doesn't have to necessarily be a vaccine.
Right.
Environmental factors, exercise, diet, but also certain vitamins are also very helpful that we know about.
All right, very good, Doctor. Nice to have you on.
Thank you very
And
much.
if you want to contact Breastlink, their number here in Laguna Hills is 949-770-0797. Thanks for joining us. We'll be right back.
Thank you.
I find it, you often hear about
At Breastlink, we offer an extensive list of services provided by our team of dedicated breast specialists. Under one roof, we provide surgery, oncology, imaging, research, plastics and reconstruction, to volunteer services. We have it all. Breastlink Laguna Hills is a comprehensive breast center and the first center in South Orange County to offer low-dose 3D mammography. Our convenient location is accessible by Laguna Woods Shuttle, which stops right at our front door. Whether you need us now or later, we're always here.